May I come in, sir?
Yes, come in. Your good name, please.
My name is Dr. Bhavik Suresh. I've completed my Doctor of Pharmacy and I've completed my medical coding course from Cardiovascular Solutions.
Okay, Bhavik, introduce yourself little louder.
Okay. My name is Dr. Bhavik Suresh. I've completed my Doctor of Pharmacy and I worked for 3 years. Then I completed my medical coding course, which is for 3 months, and I completed it from Healthcare Solutions.
Okay, Bhavik, very good. Okay, how to define medical coding?
Okay. Medical coding is the process of translating the physician's encounter of the patient into universally accepted alphanumeric codes.
Okay, very good. In different chapters, we are discussing like disease, diagnosis, or syndrome like that. What is the difference between diagnosis, disease, and syndromes?
So, syndrome refers to a collection of signs and symptoms or a group of signs and symptoms, and it would indicate what the disease is.
Okay.
Disease would refer to the pathophysiological reaction to an external or an internal factor.
Okay.
And the diagnosis is the process by which they confirm whether the disease is there.
Okay. Syndrome example?
Example of a syndrome is Down syndrome, which would indicate a genetic disorder.
Okay, very good. Okay. Then we have acute immunodeficiency syndrome also. Okay. Then Bhavik, in chapter 12, I think we are discussing different types of different guidelines related to pressure ulcer. Do you know any other type of ulcers in human body?
Yes, sir. There are different kinds of ulcers in the human body. We can start off by naming them as arterial ulcers, venous ulcers, pressure ulcer, which is one of the main ones. It's pressure ulcers of bed sores. Then peptic ulcers, which can be further divided into duodenal, gastric, and esophageal ulcers. There is also corneal ulcers also.
Okay, very good. Then excellent. Then what is deep vein thrombosis or DVT?
Deep vein thrombosis. Thrombosis refers to blood clot. So
Okay.
deep vein thrombosis refers to blood clot or thrombus being formed in the deep veins. It is usually seen in the leg.
Okay, very good. Okay. Then what do you know about angina pectoris?
Yes. Angina pectoris or angina refers to the chest pain that occurs when there is a decrease in the blood supply to the heart. Now, angina pectoris is a symptom of cardiovascular disease.
Okay, in this angio, the term angio means?
Angio refers to like heart, artery related.
Okay. Then in conduction system of human heart, we are discussing SA node, AV node or like that. Why SA node is called a natural pacemaker?
SA node or the sinoatrial node, continuously it contracts and generates electrical impulses. So therefore, the rhythm and the rate of the heart is controlled.
Okay.
Henceforth, it is called as the natural pacemaker.
Okay, per minute total, how many times the human heart will beat? Okay, 70 times per minute. Okay. Then what is dysplasia?
The root word dys refers to dysfunction and plasis refers to cell proliferation. So dysplasia refers to the abnormal cells that are being formed in the tissues of the organ.
Okay. What is the term MI stands for?
MI stands for myocardial infarction. It refers to when there is a lack, a reduced blood flow or stoppage of blood flow to the heart, which would lead to an infarction or the tissue death of the heart muscles.
Excellent. Then what is the difference between MI and acute MI and chronic MI?
Yes, sir. So the basic.
First of all, differentiate between acute and chronic.
The basic difference comes in the onset and duration. So the onset of an acute MI is immediate and that of a chronic MI is delayed. For the duration of acute MI, it is within a few days. The duration for a chronic MI shall be from months to years.
Yeah, it will take time. Okay,
Yes.
like acute hemorrhage and chronic hemorrhage like that. Okay. Then central nervous system. What are the main functions of central nervous system?
The main functions of central nervous system is breathing, controlling the body temperature, hormones, and also for movement, emotions.
Okay, like that. Okay. Then we already know the medical coder work in between hospital and insurance company. What is the purpose of documentation of a patient?
Yes. So the main purpose of medical coding is to convert it into medical code so that the claims that are being put forth are correctly and accurately done. So that is the main purpose of medical coding, like making it as a coded document. There are other additional benefits such as for research or
Yeah.
also for medical record keeping, which will help in the MRD department or the medical record department.
Okay, very good. You answered each and every question perfectly. And Bhavik, from this background, from this doctor background, why you choose medical coding as your career?
Yes, sir. It's actually a very relevant question, and I would like to answer that in detail.
Mm.
So, all the developing countries usually their healthcare sector is the number one priority, and for that, now medical coders are at high demand. My profile would help me like gain more in my career. Like there will be a higher career growth if I choose medical coding, and that's exactly why I chose it. And there is immense potential if I'm coming from a life science background if I have chosen medical coding. And that
Okay,
is
very good. Nice answer, Bhavik. Then, final question: what is your experience in cardio healthcare solution?
it has always been cordial and nice. People have been very friendly to me, and I've only had like happiness when I've come here.
Okay, thank you
so
for
much
your
for-
compliment. Okay, then all the very best for your bright future. Okay, thank you, Bhavik, for interacting with me.
Thank you,
Okay.
sir.